Hi, my name is Mary Ann, and I'm going to demonstrate central line dressing change. This is for BSN 366. I am in my appropriate school attire with my school ID badge. I have no jewelry on, my nails are clean and short, and my hair is secured and off my shoulder. Before I begin, I'm going to verify my physician's order for this dressing change. So now that I verified, I'm going to go ahead and gather all my supplies before I enter the patient's room. I have here my dressing kit, my clean gloves, my mask and my patient's mask, along with my waste container and my disposable pen. So once I have my supplies, I'm going to go ahead and enter my patient's room and close the door or pull the curtain behind me to allow patient privacy. I'm going to go ahead and perform hand hygiene. I'm going to go ahead and introduce myself to my patient. Hi, Mr. Smith. My name is Mary Ann. I'm going to be your nurse today. Can you verify your date of birth, your full name and your date of birth? Perfect. I am here because we have orders from your doctor to perform a central line dressing change. But before we begin, do you have any questions or concerns that I should be aware of? Perfect. Do you have any allergies? Any allergies to tape? Perfect. So patient denies any allergies, and thank you. I went ahead and identified 2 patient identifiers, letting him know that today I'm going to be changing the dressing, and he was okay with that. So I'm going to go ahead and put my mask on. I'm going to go ahead and provide a mask for my patient as well. And if there's anyone else in the room, they will also need to put a mask on, so that way we can maintain asepsis. I'm going to go ahead and perform hand hygiene again, and before I put on my clean gloves. So I'm going to hand hygiene. I'm going to go ahead and put my clean gloves on, and this is non-sterile glove, by the way. So before I remove the old dressing, I want to just gently look at the area before I remove it, and just inspect it to ensure that I identify how my dressing looks like, my old dressing, so that way we can go ahead and document whatever we are inspecting or assessing. If the dressing was saturated, we want to make sure that we document that as well. The dressing right now looks good, so I'm going to go ahead and remove it before we put on the new dressing. So we're going to go ahead and lift each corner of the old dressing, pulling parallel to the skin. With my non-dominant hand, I'm going to go ahead and hold the catheter in place to prevent from accidentally dislodging the catheter. And then with my dominant hand, we're going to use that to remove the old dressing. So lifting each corner first. And we're going to go ahead and remove the old dressing parallel to the skin and the insertion site. Old dressing, we're going to go ahead and place it in the appropriate waste container. As we're looking here before we put the new dressing on, we're inspecting, we're assessing to ensure that there's no redness, no drainage, no swelling, any signs of infection. You can just slightly palpate and also feel for warm temperature, because that could also be a sign of infection. I want to ask the patient as well if they're experiencing any pain or discomfort. And we're just looking around the surrounding. We want to look at the catheter itself to ensure that it's intact, and that there's no kinks on the tubing, because that can interfere with the catheter, and we just want to make sure that everything is intact. The skin is intact, the catheter is still intact, so we're good to go. So first I'm going to go ahead and remove my old glove, my used glove, and we're going to go ahead and place it in the waste container. I'm going to hand hygiene. Next, I'm going to open my sterile kit. So from the corners, I'm going to open it, and I'm just going to pinch the corner, and I'm going to open it away from me. I'm going to pinch the corner of the kit to ensure that the flap doesn't come towards me and possibly break sterility. So I'm going to go ahead and remove my gloves and place it on my clean flat surface. I'm going to go ahead and open it. And we are touching 1 inch of the border, just like that. Next, I'm going to, with my dominant hand, I'm going to pinch the cuff, just like this. And with my thumb up, I'm going to still pinching the cuff from the inside and putting on my glove like this. With this hand, I'm going to cuff the other glove. With my thumb out, I'm going to slowly insert my hand like that. Now that both gloves are on, we want to make sure that our hand is above our waist at all times. Next, what I'm going to do is I am going to get my gauze and my chlorhexidine. So my chlorhexidine and my gauze. Using my chlorhexidine, before I use it, I'm going to go ahead and crack it, and I'm going to wait for the sponge area to be saturated with chlorhexidine, so that can take a few seconds to do that. In the real world, we would wait until that sponge is fully saturated. Now that the sponge is fully saturated, I'm going to grab the other ends of the catheter with my sterile gauze. Holding the tubing in place, we want to make sure that we're not pulling or tugging on the line, because that can potentially dislodge the catheter, and we don't want to do that. With the chlorhexidine, we want to make sure that we are cleaning the area, back and forth friction, and we're going to do it 30. We're going to count to 30. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. When we're cleaning it, we want to make sure that we're cleaning equal size as the new dressing. So now that we have cleaned it with chlorhexidine, we're going to go ahead and allow it to dry. So we're going to go ahead and, before I do that, I'm going to, when I clean the area, I'm going to go ahead and clean underneath the tubing as well. And on the top of the tube. And then we're going to allow this to dry for about a minute. We're going to wait for it to completely dry. So I'm going to go ahead and discard of my gauze and chlorhexidine into the waste container. We're going to allow the area to dry. Once it's completely dried, then we'll go ahead and put the Tegaderm dressing on. We do not want to blow on the area for to dry it faster, because that's just going to reinforce contaminants and any toxins that could potentially lead to infection. So we don't want to blow on the area, to dry it. We just want to let it air dry. So once that's completely dry, we're going to go ahead and grab our Tegaderm, and we're going to go ahead and place this new dressing on our clean area. So we're going to go ahead and place the new Tegaderm on, just like that. We're going to put it over the catheter, ensuring that we're covering the whole catheter. We want to ensure also that we are not, that the catheter is nice and smooth on the area, to ensure that it's completely secured and closed. Next, we're going to lift the border of the Tegaderm, and as we're pulling it off from the dressing, we want to just slightly press on the edge to ensure that the dressing is secured. Because sometimes when you're lifting the border, the Tegaderm wants to lift with it, so in ensuring that you're pressing it down as you're lifting it up, just like that. Next, I'm going to initial, date, and time my label. So I'm going to go ahead and initial, put the date, and then the time. We're going to place the label on the side of the insertion site. We do not want to put it over the catheter, because we don't want to cover the catheter. We want to be able to visualize the catheter. That way we know we can keep an eye on it and make sure that there's no infections. So we're going to place the label just on the side of the dressing, just like that. Next, I'm going to go ahead and remove my gloves. Remove my gloves. I'm going to go ahead and gather my supplies. I'm going to place my catheter kit and dirty gloves in the waste container. I'm going to go ahead and remove my mask place it in the waste container. I'm gonna remove my patient's mask. I'm gonna put that on the waste container. I'm gonna go ahead and toss this in the waste container as well. My disposable pen goes in the waste container. I'm going to hand hygiene. I'm going to position my patient in a comfortable position, ask him if he has any questions or concerns before I leave. I'm going to lower the bed to its lowest position. I'm going to make sure that the bed is locked. I'm going to provide the patient his call light and ensure that that he doesn't have any questions. I want to make sure that he's comfortable. So Mr. Smith, we have concluded our procedure. Do you have any questions before I leave? Great, thank you. Just let us know if you need anything, okay? All right. So after my procedure, I'm going to go ahead and leave my patient's room. I'm going to document my procedure. I'm going to document my assessment findings and document that I changed the central line dressing, and that's it. That concludes my video. Thank you.